Hello, Assalamualaikum, and welcome back to Medix Mentor. This is me, Saber, and welcome back to another video for the DHA, HAAD, and Prometric exam for Saudi, Qatar, Oman, and Kuwait. So let's begin to the practice test questions. Question number one: a nurse is conducting an awareness class for the mothers about the common health concerns primary school students and the requirements for the admission. Which of the following is a requirement period to admission to the primary schools? Options: a family history record. Option B, sclerosis screening results. C, immunization record. D, medical history record. So the correct answer is C. Immunization record is the most likely requirement for the admission to the primary schools. Schools often require proof of immunization to protect students and the school community from the preventable disease or the infectious diseases. So correct answer should be C. Let's begin to the question number 2. A 9 weeks pregnant primary gravida woman is on her first antenatal visit. After completing physical examination and history, the midwife found out that her husband has sickle cell anemia minor. What should be the most appropriate plan of care? A. Genetic counseling. B. Identify severity of the disease. C. Discuss the chances of transferring to the offspring. D. Amniocentesis to identify genetic abnormality. The correct answer is A. Genetic counseling is the most appropriate plan of care. Given that the husband has sickle cell anemia minor, there is a risk of transferring gene to their offspring. Genetic counseling can provide the couple with the information about the risks, potential outcomes, and available options such as carrier testing and perinatal diagnosis. Question number 3. A 35 years old woman with poorly controlled gestational diabetes delivered by the caesarean C-section. After 39 weeks of gestation, the neonatal admitted to the neonatal intensive care unit for the observation. He has stable vital signs and good sucking. Which of the following can be done to prevent hypoglycemia? A. Provide oral feeding. B. Keep NPO with observation. C. Administer Ringelactate. D. Administer the state insulin. The correct answer is A. Provide oral feeding is the most appropriate way to prevent hypoglycemia in a neonate born to a mother with the poorly controlled gestational diabetes. Oral feeding helps to maintain blood sugar levels and prevents hypoglycemia, which can be serious consequences for the newborn. Question number 4. A nurse is assigned to care for a newborn with hyperbilirubinemia on phototherapy treatment. What is priority nursing intervention to reduce injury related the use of phototherapy? A. Monitor weight loss daily. B. Assess Fontenot's depression. C. Close eyelids before applying eye patches. D. Avoid the use of oily application on the skin. Correct answer is C. Close the eyelids before applying the eye patches is the priority nursing intervention to reduce the injury related the use of phototherapy. Exposure to blue light can cause retinal damage, especially in newborns. Closing the eyelids before applying the eye patches help protect the eyes from the excessive light exposure. Question number 5. A newborn with a meningomyocele was admitted to the neonatal intensive care unit 4 hours ago. Which of the following would be the priority of nursing intervention when caring for this newborn? A. Prevent infection. B. Promote healing. C. Support the family. D. Prevent dehydration. The correct answer is A. Prevent infection is the priority of nursing intervention when caring for a newborn with a meningomyocele. The open spinal defect puts the newborn at the high risk of for the infection. Therefore, prevention infection is crucial to ensure the newborn's health and well-being. Now let's begin to the question number 6. A 32-week pregnant woman is hospitalized in the maternity unit. She asks the nurse on duty about monitoring of the baby's growth to ensure that the baby is really okay. What is the most appropriate assessment to performed at this stage? A. Complete an ultrasound for the client. B. Measure client's abdominal girth. C. Auscultate maternal health tunes. D. Measure fundal height. So the correct answer is D. Measure the fundal height is the most appropriate assessment to be performed at this stage to monitor the baby's growth. Fundal height measured in the centimeters from the symphysis pubis to the top of the fundus is a reliable indicator of the fetal growth during the pregnancy. Let's begin to the question number 7. During a conversation with a patient with schizophrenia, he told his nurse that I go to the gym to eat fish and drink milk. Which of the following describes the patient pattern of the thought? A. Preservation. B. Circumstantiality. C. Poverty of speech. D. Lostness of association. The correct answer is D. Lostness of association describes the patient's pattern of thought. The patient's assessment is disconnected and incoherent, indicated as a lack of logical connection between ideas. This is the common symptom of schizophrenia. Let's begin to the question number 8. A 32-year-old multigravida woman presents to the outpatient clinic complaining of dysmenorrhea and menorrhagia. She had been diagnosed with the uterine fibroids and blood studies had been ordered for her. Which of the following results should the nurse report? A. Hematocrit 37%. B. Hemoglobin 90 gram per deciliter. C. White blood cells count 10,000 cells per cubic millimeter. D. Platelets count 3 lakh platelets per microliter. The correct answer is B. Hemoglobin 90 gram per deciliter should be reported the consultant. A hemoglobin level of 90 gram per deciliter is considered low and suggests anemia, which is often associated with the menorrhagia, excessive menstrual bleeding. The other lab results are within the normal limits. Let's begin to the question number 9. A nurse performing an abdominal physical assessment on a child notes signs of rebound tenderness and pain. Which of the following assessment techniques is the nurse most likely utilizing? A. Inspection. B. Palpation. C. Auscultation. D. Percussions. The correct answer is B. Palpation is the assessment technique most likely utilized by the nurse when noting the signs of rebound tenderness and pain. Palpation involves using the hands to feel the abdominal for the tenderness, masses, or the other abnormalities. Rebound tenderness is a sign of peritonitis, which is the inflammation of abdominal lining. Let's begin to the question number 11. A 4 months old infant is admitted with diarrhea and vomiting. To prevent the recurrence of the diarrhea, the nurse should instruct the mother to do which of the following? A. Frequent hand washing. B. Increase milk intake. C. Increase water intake. D. Change diaper frequently. The correct answer is A. Frequent hand washing is the most effective way to prevent the recurrence of diarrhea in a 4-month-old infant. By washing hands frequently, the mother can help to reduce the spread of germs that can cause diarrhea. Let's begin to the question number 12. To reduce the risk of transmitting methicillin-resistant Streptococcus aureus, which is known as MRSA, from an infectious wound, which of the following standard precautions should be implemented? A. Airborne. B. Contact. C. Droplet. And D. Reserve isolation. The correct answer should be B. Contact precautions should be implemented to reduce the risk of transmitting MRSA from an infectious wound. MRSA is a bacteria that is spread through the direct contact with the contaminated surface or individuals. Contact precautions include wearing gloves, gown, and mask. Avoid touching the patient's skin or wounds without using PPE. Let's begin to the question number 13. A 33-year-old woman has come to the outpatient clinic for the treatment of vaginal infection. Physical assessment reveals yellowish, excessive, thin, offensive, and fussy discharge. Which of the following is the most likely diagnosis? A. Candidiasis. B. Trichomoniasis. C. Bacterial vaginosis. D. Chlamydia. The correct answer is B. Trichomoniasis is the most likely diagnosis based on the physical assessment findings. Trichomoniasis is a sexual transmitted infection caused by the parasite. It is characterized by a yellowish, excessive, thin, offensive, and forced discharge. Candidiasis, bacterial vaginosis, and chlamydia may also can cause vaginal discharge, but their characteristics differ from those described in the scenario. Let's begin to the question number 14. Which of the following is the drug of choice to treat convulsions due to the eclampsia? A. Diazepam. B. Midazolam. C. Valproic acid. D. Magnesium sulfate. The correct answer is D. Magnesium sulfate is the drug of choice to treat convulsions due to the eclampsia. Magnesium sulfate acts as a muscle relaxant and helps to prevent seizures. It also used to prevent the progressions of preeclampsia to eclampsia. Now let's begin to the question number 15. When administering an intramuscular injection to an infant, which of the following site is most appropriate for the nurse to use? A. Rectus femoris. B. Deltoid. C. Dorsogluteal. And D. Ventrogluteal. The correct answer is A. Rectus femoris is an appropriate site for administering an intramuscular injection to an infant. The rectus femoris muscles is located on the anterior thigh and a suitable site for the injection in the infants and young children. Let's begin to the question number 16. Which of the following risk factors can be determined by the alpha fetoprotein analysis screening test? A. Neural tube defects. B. Placental insufficiency. C. Hydrops fetalis. D. Intrauterine growth retardation. The correct answer is A. Neural tube defects can be diminished by the alpha fetoprotein analysis screening test. Alpha fetoprotein test, which is known as AFP, is a protein produced by the fetus. Elevated levels of AFP in the mother's blood may indicate neural tube defects such as spina bifida or anencephaly. Question number 17. A 25-year-old woman who is planning to be pregnant is asking the nurse for an advice. Which of the following nutrients should the nurse highlights the need for its intake to decrease the incidence of neural tube defects? A. Iron. B. Calcium. C. Folic acid. D. Phosphorus. The correct answer is C. Folic acid is a nutrient that should be highlighted to decrease the incidence of neural tube defects. Folic acid is a B vitamin that is essential for the development of the neural tube, which forms the brain and spinal cord. Now let's begin to the question number 18. The nurse is giving health education to the parents how to reduce the febrile convulsions in the children at home. Which of the following medication is the safest intervention? Analgesic. B. Antipyretic. C. Antibiotic. D. Antiemetic. The correct answer is B. Antipyretics is the safest intervention to reduce the febrile convulsions in a child at home. Antipyretics such as acetaminophen or ibuprofen can help to lower the child's fever and reduce the risk of febrile seizures. Now let's begin to the question number 19. Which of the following type of cancer is considered as a major health concerns associated with radon? A. Skin cancer. B. Lung cancer. C. Cervical cancer. D. Prostatic cancer. The correct answer is B. Lung cancer is a major health concern associated with the radon. Radon is a radioactive gas that can increase the risk of lung cancer, especially in smokers, while exposure to the radon can also increase the risk of the cancers such as colon, cervical, or the prostate cancer. Lung cancer is a primary concern. Now let's begin to the question number 20. A woman was rushed to emergency room because of vaginal bleeding, mild cramps, tenderness over the uterus, and closed cervix. After the assessment, it was suspected that the patient may be lead to the inevitable abortion. Which is the possible management of this patient? A. Bed rest. B. Surgical management. C. Induction of oxytocin. D. Dilatation and curettage. The correct answer is A. Bed rest is indeed the appropriate initial management for the patient with inevitable abortion. Eventually be necessary to remove the products of conception and control bleeding. Bed rest can help to slow down the progress and reduce the risk of complication. So this is the end of this video, and if you like this video, then do subscribe my channel and also drop your score into the comment section. And thanks for watching Medix Mentor.